Great. Hi, Stephen.
Hi.
Do you want to introduce yourself and tell us your involvement or connection to the quilts and to HIV and AIDS history?
Certainly. My name is Stephen O'Hare. I'm Executive Director of HIV Ireland. And HIV Ireland is an organisation that's been in existence now for well over 30 years. Next year, it'll be 35 years, in fact. And it was founded in 1987 as the Dublin AIDS Alliance. And that organisation was, I suppose, it was an alliance of small voluntary organizations and groups that came together to work on the issue of HIV and AIDS. And one of those groups actually would have been the Names Quilt, headed up by Mary Shannon. But our organization has been in existence since then in various capacities. These days, we're a professional NGO working with people living with HIV and working to prevent new transmission of HIV, and working with people who are both HIV negative and those who are living with HIV and work closely with us.
Great, Stephen. And can you tell us a bit about like when would you first kind of come to know about the Irish Names Project and the work Mary Shannon was doing?
Well, that's a good one, because I've come into post in HIV Ireland. I've previously worked in human rights and quite a long time now, working in human rights on different issues in the human rights field in Ireland. I would have been aware of the work of HIV Ireland. It was only when I came into post in 2019 that I learned more about the Names Quilt project. The HIV Ireland was one of the places where the quilt was stored. Our offices are there now on Eccles Street in Dublin 7. And previously, I think the offices were down on Parnell Street. So I would have met people who had directly been involved in the quilt. We work with an organization called Positive Now, who are a sister organization of ours, and that is an organization of about 400 or more people living with HIV. It's a network right across the island. And so I would have been made aware of the quilt and its importance. And then, of course, last year, sadly, we lost Mary Shannon, who was obviously the key coordinator and person involved in the quilt. And so I got to learn from my colleagues, people like Erin Nugent and Susan Donlan, and the folks in Positive Now. I got to learn quite a lot about the importance of the quilt as a memorial, as a project, as a cathartic experience for people, and a lot about Mary as well.
Yeah, amazing. You mentioned Positive Now, actually, which is interesting because we have the original quilts that were made by Mary and her friends.
Yeah.
But we also have a quilt that I know Positive Now have been looking after, but was made by Open Heart House in 2012. Right. And I think that was linked in with yourselves as well.
That's right. And I think that was around about the time of the 30th anniversary or the 25th anniversary, I beg your pardon, of the Dublin AIDS Alliance, as it was then called. And I think there was a lot of discussion and talk about the importance of the quilt. And I think that really reinvigorated the quilt project. And so I understand from my colleague Erin that there was a lot of work done at the time. And then Erin's view would be that, whether it was, the Open Heart House quilt and the work that Positive Now have done, or the previous quilts, it really is Mary's love and indeed sorrow, as we mentioned in our annual report, that touches every quilt and every stitch in every quilt, really, as the project has unfolded over all that time. But yeah, I mean, so they really are an important reminder and an important symbol for the community of people living with HIV and the community of people who we've lost to AIDS in that time.
Yeah, definitely. And what's lovely, I think, about that Open Heart House quilt is the difference between that and the original ones, because there's so many people lost and remembered in the original quilt. But that Open Heart House one has all these lovely positive messages about people living with HIV.
Well, I think that's really crucial and very important. I mean, one of the things, I've learned over the history of HIV in Ireland, and indeed our organization, what is that change in people's experiences of living with HIV, in the change in the medication, the chance that people have been given since the advent of antiretroviral therapy. And speaking with colleagues, they would have said what was quite interesting about the late 90s, for example, was they were looking at the statistics of contact with the community, and they found that suddenly people were interested in things like education and training and further education. And what they found was people were feeling better. People were living longer. People were on the therapy. And suddenly this was changing the landscape for people who had HIV. You weren't now, expected to develop an AIDS-related illness, to develop AIDS and suffer an AIDS-related illness. Now it was living with HIV, and indeed all of the changes that brought about. Yeah. So in 2012, you're in a situation and beyond, you're in a situation where people are living with HIV, they're on effective treatment. And that means, of course, that the virus is suppressed in their system for those who have reached that situation, which is most people living with HIV. And indeed, there's loads of other positives that come out of that. You can't pass on HIV when you have suppressed the virus in your system through sex. So, I mean, that is a huge change in the lives of people living with HIV. Now, of course, there are things that haven't changed and need to change. And some of those are the stigma attached to HIV. And that is something that I think these quilts and the positive messaging that will come out of the Open Heart House quilt is trying to address. It's trying to sort of say living with HIV is not something to be ashamed of. It's not something that people should fear or spread shame about. It is a condition like many other conditions that people have. And it is something that, that when people are living with HIV, they can live positive, they can live healthy, they can lead empowered lives. And that's what this quilt really is doing.
Yeah. We've talked to Mary's family and other people about what they see as being the legacy of the quilts. And a lot of the time it's come up that they feel, that they could be used to continue the educational kind of awareness around HIV. And with your work with HIV Ireland, I mean, what do you feel the kind of current climate is around awareness? And you talk about stigma and what's the sort of work that you're doing with that?
I think it's important to know that the quilt projects in themselves have not gone away, and there are still panels and quilts to be made and being made, and it's important. I think the legacy of that is, yes, messaging, the positive messaging around living well with HIV, having life chances, having opportunities, not being held back by living with HIV is one very important aspect of it. And learning the lessons of that time gone past when things were more difficult is another very important aspect. And when you are in the presence of the quilt, you can look at that and really reflect on the lives that people had and the loss that the community has incurred in that time. And as we go forward, we have to think about how we ensure that there isn't another generation that, is impacted in the way that the previous generation was. I mean, the big talk internationally in the sector looking and working on HIV is that they want to end new HIV transmission. Well, there's a way to go to do that, but the tools exist to do that. And so it's putting those tools into the hands of the people who need them. It's putting that message into the hands of the people who need to hear it. And organizations like HIV Ireland and other organizations in Ireland working on sexual health and indeed LGBT health and working with migrants and other communities that are maybe more vulnerable to acquiring HIV. There's a lot of work still to do, but there's a role for all of those groups as well.
Absolutely. And you mentioned that it's a while to go before we maybe eradicate HIV and AIDS. But in terms of the stigma, what is the sense in HIV Ireland of how we smash that stigma, how we move forward?
It really is about changing minds. It's about education. People need to understand. There is a generation of people who are not too familiar with HIV and AIDS, and it is part of the younger generation, but also the wider community who have forgotten maybe about the crisis and have forgotten maybe some of the lessons that could be learned on this. For people who are living with HIV, the issue of stigma can be a debilitating one. It can be very difficult to negotiate life and, for example, services when there is a fear element in the room. People are wary, people are uneducated, people are, acting in a way that is contrary to the rights or the expectations of the person who's living with HIV. And so we would come across cases where somebody has tried to access a routine medical service, dentistry or ophthalmology or other services that people need. And the professionals working in that arena are not familiar enough with HIV, how to respond to somebody who is living with HIV and what it means for somebody living with HIV. And then you get these barriers, you get this experiences of stigma, you get these experiences of discrimination. And so when that is there and the community is dealing with that, we know we have a long way to go to sort of to bust that issue. But it can be done, and it can be done by ensuring that we don't stop talking about HIV, that we talk about it openly in an honest way. Those are the really key things that we need to do, and that we give people an opportunity to learn. So where can that be done? It can be done in schools, it can be done in third level education, it can be done in employment settings, it can be done in health settings, and we provide training to healthcare professionals in that regard. But it needs to be done in a way that people lose this sort of maybe antiquated, outdated understanding of what HIV and AIDS is.
Yeah, and you mentioned education, and I know from talking to your colleague Susan that HIV Ireland have an amazing archive there.
It's an extraordinary resource.
Can you tell us about that?
I can, and a lot of it is digitized. It really collects the information and the reporting, the projects, the outputs on HIV and AIDS, going back many years, going back to the 80s, and really collects into one space a history, a living history of HIV and AIDS in Ireland. And it's a really important resource that we have. Somebody very recently was asking me about Vincent Handley, because of course it's coming up on Vincent Handley's anniversary, and this year, of course, the 40th anniversary of the emergence of HIV and AIDS. And we were able to go into our archive and pull up newspaper cuttings and reports on Vincent himself. He's somebody that I remember, probably the first person I've ever heard of to Irish person to have died of AIDS. And I was quite a young man at the time, or young boy at the time, but I would remember him, and I knew of him, and I knew why we knew Vincent Handley. He was a DJ, a VJ on RTE, somebody that we would have all seen every week in, week out. But we were able to pull that up and bring that back to life, and sort of say, this is about Vincent, and this is about his work, and it's something that we could draw on. And there's quite a lot of that. We get requests all the time for accessing the archive. So we're really proud to house that.
It's an amazing resource. It's fantastic to have.
Yeah.
So I don't know if there's anything else, Hannah, you want to ask? Or?
Well, just, I mean, it's great to hear you talk about the possibility of continuing the legacy of the quilts and to kind of continue actually making quilts, which is great. But I suppose, have you anything else that you'd like to?
I mean, the work that we're doing, I think it's important to highlight. HIV Ireland works not only with people living with HIV, and that's a really central and important strand of the work we do. But we also work to try to prevent new HIV transmission and new acquisition of HIV in communities. We have programs that focus on some of the communities who are more affected by HIV and AIDS in Ireland. For example, the gay and bisexual and men who have sex with men community. And we have a program called Empower, which is really directed at that community to promote prevention, to encourage people to get tested. And these days you can test for HIV rapidly with a single finger prick, and you'll get to know the results in a few seconds. And then, if somebody is found to have had a reactive result, they can be sent for confirmatory testing, and if they need to access treatment, that's something that can be done. So that's a really important service and resource that we do. We also provide outreach to people in the community to educate them, to give them the resources and the tools that they need, and that's really important. And we do that not just, we try to do that across the different communities in Ireland. There's a sizable Brazilian gay community in Ireland, and we work very directly with them. We also work with women. We work with people who use drugs. We work with a cross section of the community to try and promote prevention. And we, as I mentioned, we provide education and training, particularly around HIV itself, understanding how to provide services in relation to HIV, understanding the stigma element of HIV. We provide this training to healthcare and social care professionals in Ireland. And that is a big part of the work that we do. And then, of course, as I mentioned, we have our very big community support program, which is available to people who are living with HIV, and particularly those who are newly diagnosed. And they're a community, of course, that we're always very cognizant of, because when somebody receives a diagnosis of HIV, even though things have changed remarkably, for them at that moment in time, it's a life-changing experience for them, and we need to be there to help them and to hold their hand a little bit on the way through that journey. But the community itself is really what makes that work very, very, very positive and easy for us, because they are there for each other, and the quilts is just a really good example of them holding that space.
Brilliant.
Perfect.
Thank you very much.
Thank you so much, Stephen.
No problem.